Well, this is a really interesting piece of science. What you see in this graphic, and of course for all of you who are listening in the audio podcast, I will try to explain what is in this graphic. But what you see here is the result of a gigantic meta-analysis conducted by Bandelow and colleagues. And this meta-analysis, which is the aggregate of many psychotherapy studies with hundreds of participants, what you see here is the comparison between different treatment methods. On top we have the psychotherapy, which is compared with medication. In the case of anxiety, most of the time people get SSRIs, the same serotonin reuptake inhibitors people get with depression. And the efficacy of psychotherapy is compared to medication, but also compared to placebo effects, if people get only a placebo pill or if they get treatment as usual. And on the other hand, it's compared with waitlist control groups. So if people don't get any treatment at all. What is really important is that these treatment results are the results for treating people with panic disorder, generalized anxiety disorder, and social anxiety. So what is really missing is specific phobias, which are very well treated with psychotherapy. So the effect of psychotherapy in this meta-analysis is definitely underrated. Maybe it's because the authors of the study are somewhat in a collaboration with pharma companies. So some of the authors are speakers for Pfizer and other pharma companies. So maybe that's the reason why they left the specific phobias out to get a better effect for the medications. Nevertheless, the results are very interesting because first of all, what is really impressive is the large placebo effect. So those people who get a placebo pill or who receive treatment as usual do much better than those who get no treatment at all. And even in comparison to psychotherapy and medication, about 2/3 of those effects can be explained by the placebo effect. So this is really fascinating. Just by being told now you get a medication that helps you to overcome anxiety, many people are able to overcome their anxiety. And this tells us how strong the power of our mind is, because a placebo effect is made by our mind. It's nothing else. You get a sugar pill, there's nothing in it. And all the effect is just evoked by your mind. So this is a first really interesting result. But another result is that after the treatment ends, you can see that the line for psychotherapy still goes a little bit up, whereas the line for medication drops. So those people who received the psychotherapy, even after the psychotherapy ended, experienced improvements in their well-being. And this really speaks for that you learn some strategies which you can apply even after the treatment ended. For example, and this is quite simple, you learn how important it is to face your fear. That you don't avoid situations. But on the other hand, you also learn the power of cognitive restructuring. You learn how effective it can be to get a new perspective on things. For example, in one psychotherapy, which you can also see on TV, I put a link on the German website where you can find all the video resources to the book. In this psychotherapy with a woman who was afraid of driving because she experienced a horrible car accident, she experienced a strong breakthrough when she realized that it was not the car that almost killed her, but of course it was the fault of the other driver. And instead, the car in fact protected her. The car shouldn't be feared, the car should be celebrated because the car saved her life. And this change in perspective led her to enter a car again and finally to be able to drive the car on her own. So we shouldn't underestimate the power of the cognitive component in the treatment of anxiety disorders. For example, realizing that in fact in the past nothing really happened, or realizing that it was just one single event and before you had no trouble and after this event Of course, you were afraid all the time, but did there really happen that much? So there are a lot of cognitive strategies that can be learned and that lead to long-lasting effects. I hope you enjoyed this episode and maybe it was a little bit helpful. And if you want, we'll see you next time.